So my name is Shoshana Funk. Welcome to the 8th annual Day 2 of Aging and Thriving. I'm the Senior Director of Helping at Jewish for Good. My colleagues here are Stacy, Emily, and Jordana. We are the helping department here at Jewish for Good. Thank you for joining us for this special program funded in part with grants from the Carolina Foundation for Jewish Seniors and the Leon Levine Foundation. Jewish for Good's Helping Department offers a comprehensive range of services that help people meet life's challenges. We deliver high-quality professional services for adults and their families through all stages of life. This includes counseling, case management, financial assistance, food pantry, and programs like this one. Much of what we offer is free, and all of it is open to everyone, Jewish or not. For more information, I invite you to visit our website, jewishforgood.org, to look at our upcoming older adult programs we have planned, like Shmooze and Nosh, our Care Partner Support Group, and our Memory Cafe program. Additionally, we recently opened an adult day center, the Ginda Center. For those who are interested in learning more, you can contact any one of us after this program. So without further ado, I would love to introduce our speaker today, Katherine Swartz. She's a professor emerita of health policy and management in the Department of Health Policy and Management at Harvard, the T.H. Chan School of Public Health. Her presentation title today is Retirement Communities 101. Of course, this is why you are here today. And Katherine Swartz is an economist and a professor emerita of health policy and management at the Harvard T.H. Chan School of Public Health. For the past year, she and a friend from graduate school have been writing a non-academic book about issues people should know about if they are considering moving to a retirement community. She has been on the board of a continuing care retirement community in Massachusetts for the past 7 years, but lives most of the year in Durham, North Carolina. So I would love to toss it over to you, Katherine. We're so excited to hear from you and learn with you today.
Thank you. Thank you. Let's get this slide sharing going. And well, this worked before.
Here we go.
You seeing everything?
Yes, that looks great.
So I'm getting a whole lot of other things coming up on this. All right. So just as in addition to saying thank you to having me, I should say that I've never shared slides on Zoom before. I've, of course, used slides a lot, but this is a very weird experience of speaking to my computer and not really seeing all of you and not getting reactions. So I hope this works pretty well. Let me start off by saying that the fact that you're all here, I think, reflects the fact that thinking about whether or not you want to move to a retirement community is really a hard thing to think through, for most of us anyway. And unless there's some sudden urgent reason for moving, it really helps to take the time, like you are this morning, to look at alternatives, learn about issues that differentiate different types of communities, and within a type, even the communities that fit that type, and really get information that will answer questions that you should have. At the same time, I want to urge all of you to think about the fact that this is a good thing to do to get information while there isn't a crisis on your table. But there's a line from Shakespeare, from the Merry Wives of Windsor, that I love, which is better 3 hours too soon than a minute late. And that applies to deciding what you want to do about staying where you are versus maybe doing some interim step versus moving to a retirement community or somewhere else. So first of all, let's, this was working before. Think about what I'm going to talk about today, what we're going to cover. So I'm going to briefly go through why you might want to consider moving and or not moving. And then go through, and I'm going to do that pretty briefly, of why you might want to consider moving. And then what are the 3 major types of retirement communities? How do they interact with skilled nursing facilities and supportive services? how many of these different kinds of retirement communities have SNFs or different levels of supportive services. And then very briefly go into two types of what I think of as specialized communities that we're really not going to focus much on, but you ought to know about, which are memory care communities and nursing homes. And then I want to go through some issues that you should think about to avoid surprises, both good surprises and bad surprises. And I just want to note that I'm not talking about the larger public policy problem of the need for more assistance for seniors who need help with activities of daily living. That's not part of what we're talking about today. And mostly what I hope you'll walk away with are two things. One is ask questions when you visit. Make sure that when you go visit any of these communities, you ask questions, because sometimes the answers you get will be pretty revealing in terms of they may be dodging the question you've asked, or they'll give you details which really would be very helpful. And the second takeaway message is don't avoid planning to either move or stay where you are. I think there's a certain amount of saying, well, I can think about it tomorrow, but don't do that. This is something to really take seriously while you have time. Okay, so quick recap, since I'm sure all of you are already thinking about this. These are reasons that a lot of people give of why they might want to stay, or sorry, this has moved too soon. Let me go back if I can. Why might you want to move? So your home has features that increase the risk of falling. I think a lot of people will say to me, you know, I really like going up and down stairs. It keeps my heart healthy. At the same time, you know, Archibald Cox talked about sort of, somebody asked him when he was quite a bit old, I think he was close to 90. He said, what's your secret? And he said, I grab the railing all the time. So think about features that you might think about, as those could be dangerous. Second reason, of course, that a lot of people give is it's just taking a lot of time to maintain my home. And I worry that the people that I've hired may not be doing it the way I would do it if I were doing it myself, like I used to. You should think about whether or not you or your spouse or partner have possible health conditions that could, in fact, make staying in your home less easy and more dangerous. A fourth reason that I hear a lot is so the children won't worry. Many people talk about that if I move, my kids aren't going to worry about me. That may be true, but sometimes kids get involved, adult kids get involved in looking at places with you and say, that swimming pool looks terrific. You used to swim all the time. So be careful when you say, so the children won't worry, that you don't start buying into the idea that they're excited about someplace and you might not be. But it is a reason, perhaps, to move. Another reason that I frequently hear is the neighborhood's changed. My friends have moved. It's no longer what it used to be. I don't really know the people who live next door to me. I don't really want to be here anymore. That's a pretty good reason to move. Another one is, and this I saw with my parents, that it gets harder to drive or get to medical appointments. A lot of medical facilities, as you know, especially in the Triangle region here, have moved to larger buildings. It seems like a great idea. They're consolidated, so you can get lab work done in the same place or go to several different doctors at the same time. But they are located off of very busy highways, and maybe you don't like driving at 60 miles an hour anymore. Another reason to think about moving, though, is that there are waiting lists for moving to continuing care retirement communities, CCRCs, or to assisted living communities, especially those that are well-run and people want to move to. And I would say, we're going to come back to this in a few minutes, but I would say this is an important thing to think about as to why you might want to consider moving now and at least getting on a waiting list, or several different CCRCs or assisted living communities waiting lists. It doesn't cost much usually to put your name on the list, somewhere between $500 and $1,500, which would be, most of which would be refunded, but at least it gives you an option. Okay, why might you want to stay? And here there are lots of reasons that all of us have. You have strong emotional ties to the house that you've lived in for a long time. Probably you've done additions to it or made changes that really reflect who you are. Maybe, in fact, you've done some modifications already that make your home safe. It's a place you could grow older in, and that was your intention. You may have a very strong support system of friends or paid help or family who live nearby. And there are even these naturally occurring retirement communities, sometimes referred to as NORCs, where people who know each other and maybe don't know each other that well, but they belong to essentially like a co-op that help people if they've got short periods where they're recovering from, say, a knee replacement or a hip replacement, and they just need someone to help run errands. Another reason why you might want to stay is that where you live has very convenient public transportation, or you've already gotten very used to using Uber or Lyft, one of the ride companies. But, make sure that you can use these reliable, convenient public transportation modes if you think this is really why you want to stay. And there's another point here that many people believe that, all I have to do is make a few phone calls and I can get aids if I need help for some kind of short-term recovery period. I think that was more true before COVID. As many of you are quite aware, there's a shortage of people who are willing to be home health aides. And it is something that, on the one hand, if you have a good support system of people who can sort of plug you into either agencies that supply aids that are viewed as reliable and good, that's great. But just think about that point. It's not always the case. Lastly, in thinking about, do you want to move, do you want to stay? I think it's really important that you think about your future self. And that, thinking about who your future self might be helps a lot in figuring out why you might want to move, why you might want to stay. Because you are, of course, making a decision not only for your current self, but who you might be or who you think you might be in the future. I think a lot of us can think back over the last 10 years or last 5 years and realize how much we've changed or not changed. And as I said, there's a certain number of adult children who say that swimming pool looks great. You used to swim. Think hard about that. Are you really going to swim a lot or not? I think that it's important to be realistic about your expectations of any limitations that could affect your future self. Sometimes it helps, at least for me, since I know that my grandmother went blind by the time she was 90, and my father had problems with vision. So do some sort of experiment with yourself. What would you really like to do that maybe you're going to have trouble doing in the future? Either because you know that that's something that's affected other members of your family or friends of yours. And the last thing I really want you to focus on is if you have a spouse or a partner, you really need to spend time talking with the other person to make sure that you're on the same page. And this is one of those kinds of conversations that's not going to be one conversation, it's going to be many conversations. And there may be zigs and zags where one person says, I'm really ready to do this, and the other person says, I'm not. And a few months later, you've just switched. So don't be surprised about that. But, you really need to be on the same page if you decide you're really going to move out of your current home. So with that as background, and hopefully consolidates your thinking about this, let me do a quick overview of what the 3 major types of retirement communities are. And then, it's like I said at the beginning, we're going to be sort of peeling away an apple or an onion, however you want to think about this, and get further into what differentiates these 3 types of retirement communities. So the first one we'll focus on are continuing care retirement communities, usually referred to as CCRCs. They are sometimes known as life plan communities. There are about 2,000 of these CCRCs in the United States, and the vast majority, 80%, are nonprofit organizations. The second major type are known as assisted living communities. And I want to make this point that our focus today is on communities with at least 25 residents. Often it's closer to 50. or it can be even larger than that. But we are not talking about these they're residential care homes, which often have 8 or fewer residents, and they are in homes in neighborhoods when you may not even be aware that they're there. The point of assisted living communities, in their being designed in the last several decades, is to contrast with nursing homes. The idea is that people need assistance with activities of daily living, but they do not need the level of assistance that you would get in a nursing home. And I'll come back to this. About 70% of assisted living communities in the United States are for-profit organizations. The last type that we'll talk about today are what are known as age-qualified or age-restricted communities. These are for people generally 55 years of age and older. In some some towns or states, they say you have to be 60 or older, but think of it as in the mid-50s or older. And they really advertise and market themselves to people who think they want active living or they want to be in an active adult community. And most of these are rental properties. And again, I'll come back to talking about that. The major thing to realize about these communities is it's a really rapidly growing sector of this whole market of retirement communities or senior living communities. And the vast majority of these active living or age qualified communities are for profit. Okay, so let's go diving into CCRCs. And again, I'm going to go through these. Here are some differences, and then I'm going to come back at each of the three. So we're sort of digging further. CCRCs are the most comprehensive of these three types. They promise a continuum of appropriate care. That's why they are sometimes referred to as a life plan, that you move in and you should expect that they will take care of you and you can live there the rest of your life. They have different levels of housing and amenities for independent living. And I think it's important, that's where going and visiting, or at least seeing them, you can certainly go zooming around and just see how different the housing looks and how large the apartments are and different types of amenities. But these are really for people who want independent living. Multiple levels of assistance and health-related care are available within the same community. And that's the whole point, that you will get this continuum of appropriate care. So if, as you age, you start needing some different types of assistance, or you need some kind of more intense nursing care, it will be provided by a CCRC. That's their promise. And the idea is you will not have to move. They almost always require that you can live independently to become a resident. So this involves, you get on a wait list, you may wait several years, and at the point when a type of apartment that you have said you would like to move into becomes available, you then have to fill out more detailed information about your finances. But in particular, you are asked to come in and do some cognitive tests with someone at the CCRC, usually a social worker, and provide information about how your physical well-being has been for the last year or 2 years. Sometimes they do a physical, but most of the time they want access to your medical records. And people can get to the point where they cannot pass a cognitive test, or they have developed a condition which would cause a CCRC to say, I'm sorry, we cannot have you as a resident. In other cases, I know that people who have a chronic degenerative kind of disease, including Parkinson's, may be admitted because they are in very good shape right now, but their fees will be higher with the recognition that they may need more assistance before they pass away. Another thing about CCRCs that you should know sometimes differentiates them is that some, not all, have skilled nursing facilities on site. And the whole point is to provide you with this continuum of care. And skilled nursing facilities provide short-term, post-acute care. So the idea here is that you may have been in the hospital for 4 or 5 days with an infection, maybe it was pneumonia, or you've had some kind of bad break of your leg or something, and again, you're in the hospital for several days, and you need some kind of physical therapy and more assistance than just going home. So a lot of CCRCs, when they were built, created a skilled nursing facility on site that would provide this short-term post-acute care. And Medicare will pay for that as long as you have qualified by being in the hospital at least 3 overnights. This is all changing. This is an area that's changing rapidly as I'm even creating these slides. And it's something to keep an eye on. A number of CCRCs have begun to close their skilled nursing facilities because their residents are not meeting that qualification of being overnight in the hospital for 3 nights or more. And instead, they have expanded their assistance level. And again, depending on, sometimes Medicare will pay for that, depending on particular examples. But otherwise, it's covered by the entrance fee and monthly fees. So I'll come back to that, but it's something to realize that this is a changing area. The big advantage of moving to a CCRC really is this promise of a continuum of care, so you'd get appropriate care the rest of your life. You won't have to move. And it's easy if you should end up needing to be in the skilled nursing facility or assisted living neighborhood of the CCRC. It's easy for your spouse or your partner or friends to come visit you, to just drop in. You're all in the same location. All right, assisted living communities. They sort of fall somewhere between being in a CCRC and a nursing home. As I said earlier, they were initially the idea for this was you didn't need to live in a nursing home, that your assistance level needs are lower than what people going to a nursing home have. So it really is to offer some kind of living arrangement for people who can no longer live safely at home independently. And there are many varieties of these assisted living communities in terms of how many people are residents, what the layout is of apartment units. Some cases, it's simply the person wants a bedroom or an efficiency type of apartment unit. In other cases, you can have a sitting room and a bedroom, private bathroom, of course, and then many different types of amenities, because some people still want to have an exercise room. Other people cannot take advantage of the exercise room. 70% of the assisted living communities in the country are for-profit, and many of them are part of a larger system of assisted living communities. And you probably know the names of at least 3 of the systems, which are very large. One is Brookdale Senior Living, another is Sunrise Senior Living, and Atria Senior Living. I'm sure you have seen their names on senior living communities or just driving around. One more thing I want to point out about assisted living communities is that some specialize in providing memory care. And this is something to keep an eye on. We'll come back to it in a few minutes. But especially in urban areas, say like the Washington, D.C. suburban area, there are many of Brookdale, Sunrise, and Atria Senior Living assisted living communities. And each of them has either 1 or 2 of their communities that really specialize in providing memory care. So it's just something to keep an eye on. Okay. The third kind that I've talked briefly about are these age-qualified communities for active adults. And these are mostly rental apartment buildings. There are some communities that have a mix of apartments and small houses. And some are right next door to larger apartment complexes. So it's sort of like a building within a larger complex, so that if you wanted to use the swimming pool, everybody's in that swimming pool. It's not just the people who are in the age-qualified building. The amenities that they do offer are really directed at physical activities. And some opportunities for social interactions. So think about, they just announced that there's going to be a monthly wine and cheese or Taco Tuesday. So people can come if they want, they don't have to. The idea simply is that a lot of people who want to move to an age-qualified community are thinking of themselves as still wanting to do lots of physical activities and also have an opportunity to mix with other people who live there, and maybe they do other things with them socially. None of these have formal dining facilities. I have to say that Uber Eats and other types of food delivery apps on your phone that have developed in the last decade or 15 years have greatly increased the attractiveness of these apartments for age-qualified adults because the developers don't have to worry anymore about, do they need a formal dining room? They know that the people who want to live there are more than happy to have their food delivered right to their own apartment, and that's the end of it. There may be a morning coffee bar in the lobby, sort of as a way of, some people want to go down and socialize. And there can be small rooms available for hosting your own private party or maybe one of the monthly wine and cheeses, but that's it. And as I said earlier, this is a growing market area. It is really a response to the rising number of those of us who are retiring baby boomers who may want an alternative to the cost of living in a CCRC, or they're not ready to think about moving to an assisted living community. And I can talk about some of this a little bit more in the Q&A, but this is a very recent phenomenon that we are seeing, that some of these age-qualified communities are beginning to offer health-related amenities. And I'll come back and talk about that in a few minutes. So what differentiates these three different types, really? And the major differences have to do with costs, which of course depend on what else they're offering. So let me go through first an overview, and then we'll go to each one of these. I also want to note that, of course, the cost differences are affected by where are we talking about? Where is one of these communities located? Is it in an urban area, more of a suburban or rural? What part of the country? Are we talking about the Southeast? Are we talking on the West Coast, or maybe close to New York? All of the differences, variations in the costs of labor, land, utilities, local and state regulations on building, all of that impacts the cost of particular ones of these communities. So if you're looking, say, in the Triangle area, we're pretty much all the same in terms of cost of labor, utilities, that kind of thing. But if you were comparing here to, say, a more rural area outside of Chicago, you need to realize what could be driving some of the cost differences. The chief factor that we'll focus on here is the extent of the healthcare services and assistance that are provided across these three types of senior living communities. And the second thing is really the scope of amenities that are offered. And within that, you need to focus on whether or not the costs are really shared by all the residents, or they've figured out that there are some types of amenities that only certain people want to use, and therefore they simply charge them a user fee for every time they use it. Not everybody wants to use a boxing ring, for example. I'm just making that one up, but then you might have a user fee. Another aspect to focus on here is whether or not there's a dining facility or more than one dining facility, and how do they set the charges for the number of meals that you might be using? Do they say you automatically are going to have 30 meals per month and you can do that anytime you want? Are you allowed to carry forward if you're going to be gone for a week? How does that all work? So asking those kinds of questions, because they differ. And the fourth major difference, looking at the costs, is something to start asking about the business model of the way the community is managed. And you can't come right out and ask about their business model, but you can ask questions that get at it. So the first thing is whether or not it's a for-profit or not-for-profit ownership structure, whether or not they are adequately funding, so their capital reserves, so that the quality of the community's buildings and services are likely to be maintained or maybe even improved. And then especially for CCRCs, are they sufficiently pre-funding what you would expect the future healthcare costs or assistance costs to be for any of the residents? And when you often hear about or read that a CCRC has gone bankrupt or closed, it's because they did not do enough in terms of pre-funding, going through all the actuarial models of what those future health expenses or costs for assistance might be. So let's go through these. So I'm going to talk really about the entrance fees, monthly fees, supplemental charges across all three of these types. And let me just check time. Okay. With CCRCs, there are substantial entrance fees. These are often called buy-in fees. And I want to make sure you understand that these are not equivalent to buying and owning the unit. You are not buying the unit. You are paying what the CCRC says, here's our entrance fee. And it is designed, usually if it's the CCRC that's well managed, to help pre-fund your future healthcare expenditures. The typical entrance fees right now, and I hope you're all sitting down, can be anywhere between $500,000 to $2 million or more. That amount varies a lot depending on where in the country you're talking about, that is to say, construction costs, what the local market is. Is this a CCRC that a lot of people want to live in? It also depends on the size of the apartment unit that we're talking about. And so thinking through how big an apartment do I really want, that's going to affect when you start looking at these different entrance fees. And also sometimes the desirability of where it is even within the building. You know, if it's close to a lake, do you have a view of the lake or not? Do you care about that? How often are you going to look at the lake? So just so you understand, there's a substantial entrance fee to move into a CCRC. Most of CCRCs actually refund a share of the entrance fee when an apartment leaves, either to the resident, because the resident says, I don't want to live here anymore. Maybe my children have moved to the West Coast and I want to move there. Or when they pass away, the refund is given to their estate. But the share of how much of that entrance fee is actually refunded varies a lot. In many places, it's 90%, but it can be anywhere between 90% and 50%, could even be zero. And this is not done as much anymore, but another way of doing this is to have it decline by 2% a month, every month. So basically 4 years and another month. The idea being when it declines like that, if you've been there that long, more than 4 years, you're likely to have healthcare expenses that the CCRC wants to keep that money for to be able to essentially fund your assistance needs and healthcare needs in the future. I should add that because of these substantial entrance fees, there are 41 states right now that regulate CCRCs within their borders. And the whole idea is to protect the residents and their financial situations. So just be aware of that there are state regs to help protect you. Monthly fees are for a lot of different things. There's for the rent, the costs of upkeep, keeping up the building, utilities, property taxes, so what's your share? That's going to depend again on how large your apartment is. The monthly fees also cover the dining facility, how many meals you have, that they just say we're putting that right into the monthly fee as opposed to a user fee. It will cover the activities and amenities that most residents are using. and some health services. I'll come back to that in a few minutes, but just think of it as sort of here's the monthly cost of living in a particular place with all the things that are what makes it a place you want to live. There are then these supplemental charges for services that are not being used by all residents, but are available a la carte. So simple examples of that is that a lot of CCRCs will have a place where you can get your hair cut or your nails done. Those are available a la carte. They do not fold those costs into the monthly fee. Other situations where there could be a supplemental charge really has to do with how much the CCRC has decided that these are amenities everybody wants, and so they should share in those costs. Maybe the library, for example, how are you possibly going to divide that up by how many books somebody takes out? Versus those where they know that not all residents want them. And that may be using the bus, for example, to go to a concert downtown. Of course, the people who are doing that should be helping to pay for the cost of the bus. That's the attitude they have. Thing to keep an eye on here is that the contract types and are really, there's a lot of different arrangements, and I have in the supplemental slides these 5 different types of contract types. And there's a lot of flexibility going on right now in terms of arrangements for what that entrance fee might be and how much you're going to get back as a share of it. And you should keep an eye on that. And I will talk more about that in a few minutes, but it is something to be aware of that's not written in stone everywhere. Okay, assisted living communities. There's no real entrance fee per se, but there is usually a one-time move-in fee or what's known as a community fee, where you don't really have a choice. You're asked to help pay for the community and by giving a donation. And those fees are not refundable. It's hard to give you an estimate of what's a typical move-in fee or community fee. This varies all over the place depending on how large the assisted living community is and where it's located. All of them have an admissions agreement, which looks a lot like a contract. And again, it is a situation where every state has some regulations on their assisted living communities. The regulations vary a lot, but in terms of having an admissions agreement, which has to describe the types of care and services that a person is going to receive as a resident when they move in, including what the cost of those care services that they're saying you need, that you must get in writing when you decide to move in, and they'll give it to you ahead of time so you understand what you're going to get. The monthly fee then is a charge for the particular living unit that you've chosen. Is it big or small? And all the meals, because almost all of these assisted living communities provide breakfast, lunch, and dinner. It may be that it's only lunch and dinner and you can have breakfast where you are, but there's some amount of meals that are part of this admissions agreement. And a big part of this monthly fee, which varies for each person, is what's their assisted living care plan. That is, what are the services to be provided, which is in this admissions agreement. The thing to be very aware of is that almost all of these assisted living communities provide 3 levels or tiers of assistance. And those levels of assistance really determine what your monthly fee will be. And you should be asking questions like, well, how long do you think it might be before my loved one or I will move from level 1 to level 2? You know, what causes you to determine that? There are also supplemental fees for additional services, and you should ask about that. What else I might have to pay if I need some other types of services that are not considered part of my level. The national median annual cost of living in an assisted living community is about $71,000, according to Genworth. And that's just something to keep in the back of your mind. The last thing I want to say that's not on this slide is that these state regulations can vary all over the place, but it is important to realize that in many states, there are services listed or a level of assistance that is there in writing in the regulations that indicate that an assisted living community cannot provide those kinds of services or assistance to somebody who needs that level, higher levels. California, for example, the regulations list the medical conditions that require higher levels of care. And at that point, a person who is a resident of the assisted living community who has exceeded the third level must be moved to a nursing home. So it shouldn't surprise you that in many places, we're starting to see nursing homes and assisted living communities be joined at the hip, maybe even in the same building, but the same organization owns them. And that's been true for a while, but we're really seeing this happen right now more and more. The last thing, just as a quick thing about the age-qualified communities. This is just like moving into an apartment building when you're really young. You're going to have a lease, which doesn't have an entrance fee, of course, but it requires at least 1 month's rent upon signing the lease and a security deposit of at least 1 month's rent. Owners of apartment communities are often willing to have for you more than a 1-year lease with some sort of predetermined limit on the monthly increase that will occur over the time of this, say, a 2-year lease. And the reason is they like having people like us rent their buildings. We don't tend to trash the apartments. We are paying on time, and we're good people to have just in general in the building. They don't have to repaint every year if the lease turns over every year. We're not in that kind of category. So you can go ask about what happens if I want to have a 2-year lease. What will happen to can I get a lower lease? And just bear in mind that the monthly rents are low, largely because there are no meal plans, there's no healthcare services. But be careful, because some of these communities might start saying, well, we really want to have more social activities. We need to hire a coordinator, or we want to have more amenities. Those kinds of costs will increase the monthly rent. So just be aware that you want to be able to ask about what are the plans for this. All right, let me just talk for 2 minutes about these specialized communities. There are 2 kinds that I want to focus on. Memory care, which, as I said, are generally found as assisted living communities. These are secure, safe places, particularly for people who wander. So CCRCs, for example, or other types of assisted living communities who have people with increasing memory problems, maybe sort of low levels of Alzheimer's, once a person wanders away, they cannot safely have them as residents. So then if you live in a CCRC, they will help you or your family find another place to live, which is generally an assisted living community with a memory care unit, or it's totally divided. I mean, it's totally focused on memory care. And that's where knowing what share of your entrance fee you'll get back when you leave is really important, because you may have to then turn that money over to the memory care special community. The important thing here, of course, is that the caregivers have training in dementia care, and there are structured activities. The average annual cost of a private room, this is, I don't know if it's really that current. I would say it's probably a little higher than this, but $117,000 according to the Alzheimer's Association. Nursing homes are for people who need long-term care services. Medicare does not pay for long-term care services. I think there are many, many people who assume Medicare does pay for that, and it does not. It is Medicaid that pays for that. Medicaid is currently the payer of the annual costs of over 60% of residents of nursing homes. And I think this is something that most members of Congress and many of people in the public do not know, but it may be coming out in the next few months as the Congress is thinking about whether or not to cut back on Medicaid. So keep that one in mind. Residents who are not covered by Medicaid are the pay for their own costs themselves. This can become expensive, but generally it is less expensive than having somebody 24/7 in your house. As I said before, nursing homes and assisted living communities are subject to various federal and state regulations. It's very hard to know who actually owns a nursing home. 70% are for-profit, and within that group, 80% belong to a chain of nursing homes. So you can just you can try and find out more, but just be aware it's often difficult, and you may be in a position where you don't have time to try and figure that out. Okay, I just thought I should throw this in here of contrasting with assistance at home. In 2023, the hourly rate for homemaker services was about $30 an hour. If you wanted somebody with a little more certified nurse assistance training, you'd be paying $33 an hour. So if you just multiply that by 44 hours a week and sort of bring it up to $35.80 an hour, which I think may be a more realistic view these days, you're talking about $6,300 a month. This is not 24/7 care. And you're still, of course, they're still paying for the person living in home. So they're the, whatever property taxes, utilities, et cetera. This can be very expensive very quickly. If you have long-term care insurance, it may pay for most of the expenses, but not always. It's again, depends very much on what the details are and the contracts of long-term care insurance policies are. And Medicare will not pay for long-term care expenses unless a physician has certified that particular physical therapy or types of services will help prevent hospitalizations, which the person may have been having quite a bit. But just be aware of that. So just keep these different costs in mind. So what are the key points in comparing senior living communities? Really the comprehensiveness of the services that we're talking about. And so I've put them in order here where the CCRCs offer more than assisted living communities, more than active living communities, and just in terms of what's promised as part of the fees. And just thinking through, are you going to use all these amenities? What are the costs at entry, the costs in the future? But some points to be aware of here, how long are you going to have to wait before a community has an apartment that you want? If it's going to be 5 years, 7 years, around here, sometimes it's more than 7 years, keep your options open. Be on 3 or more wait lists. And I think another thing to be aware of in comparing these senior living communities is, does the resident or the family of the resident decide whether a move to more specialized care is really necessary? Who is making that decision? Is it the CCRC social workers? Is it whoever is in charge of the nursing within the assisted living community? And all of a sudden you find that your loved one has gone from level 2 to level 3 and the monthly costs have doubled. I mean, who is making that decision? Ask those questions. So what are some issues to learn about and ask questions so you can avoid some of these surprises I was talking about? First of all, almost all of these CCRCs have a wellness center, but wellness centers are not urgent care centers. And in most states, a nurse who is staffing a wellness center cannot diagnose the symptoms that you may have walked in with. You need to be sent to a physician, or if you're lucky and it's a larger CCRC, maybe the physician is there that day, in which case either the nurse or a nurse practitioner can interact with the physician and be told you can be told what's wrong. Otherwise, you're sent to your physician. They're told to go make an appointment. Another one is, what happens if you fall? You just fall. It turns out that in many states, excuse me, you cannot be picked up by a staff member or assisted unless the staff member has EMT training. So otherwise, the CCRC or the assisted living facility has to call the local fire department, who comes and an EMT lifts you up. Another question to ask, a lot more questions about, are really what services are covered by that monthly fee versus what kinds of things you pay a supplemental charge. And as I said before, what happens? Do you have any recourse if, say, an assisted living facility believes that your needs for assistance have increased? So you're going to go from level 1 to level 2. Can you hire a private aide? In many cases, they're more than happy to have you hire a private aide to provide work that otherwise they would have nurses doing or nurse aides. But then you may be paying for level 2 in addition to paying for the private aide. So, get those kinds of questions straight. And lastly, if an age-qualified community is having an arrangement with a skilled nursing facility nearby to provide post-acute care for its residents. So if a person has broken a leg and needs some post-acute care and needs to go to a skilled nursing facility, will this age-qualified community resident have priority to get into the nearby skilled nursing facility? Well, learn more about that. Which hospital is it connected to? And just, is this a place you would like to have post-acute care provided? Let me sort of go through a couple of risks and benefits just to line them up, and you can have these slides, of course, to keep. It's really important to think about these two risks. CCRCs have wait lists, as I've said several times, and you could miss a window for you decide, okay, I really do now need, or my spouse or partner needs to move to a CCRC. We cannot be in our home anymore. But if you haven't done anything about putting your name on a wait list, you're stuck. And waiting now another 3 or 5 years, your health can decline and you might not pass either the physical or mental acuity requirements that CCRCs have before you're admitted as a resident. And is a real risk. So getting your name on a waiting list, and if your name comes up and you're really not ready to move and you feel like, we're still healthy, no problem, you can say, just keep me on the list. Call me again the next time the same apartment comes up. The other real risk is that the financial management of a CCRC or assisted living community may not be very good. So learn as much as you can about the financial health of a community. You can ask for the latest or the last couple of years of their financial reports. If it's a nonprofit, these are easily publicly available, but you can get them. And check how many days of cash on hand they have, as well as the percentage of living units that are occupied. That will tell you something about whether or not they have enough money to be able to promise you that they'll maintain the quality of care and be able to care for you. And I think, another thing is whether or not management seems to be responding to competition from other nearby CCRCs or assisted living communities. What's their plan for capital expenditures to make sure the roof, any kind of shared expenses, is the roof going to be replaced because maybe it's 20 years old? How are they thinking about the replacements of things like that? On the other hand, there are real benefits to consider as well. If you or your spouse partner need more assistance with activities of daily living, or you need some kind of short-term skilled nursing care, it is so much easier to obtain that care if you live in a CCRC, even if it does not have its own skilled nursing facility. Because these CCRCs that don't have a skilled nursing facility have arrangements with others nearby that do, but it is so much easier if you suddenly find yourself saying, oh my God, we really are going to need help. The second benefit is that people really seem to age well. There's a lot of building evidence on this. If they have social interactions, they eat nutritious meals, and they get physical exercise, which is more likely to happen in communities, whether it's a CCRC or an assisted living community or in an age-qualified community. So one of the things that I've been struck by in my being on the board of a CCRC in Massachusetts is that people talk about, I have long-term friends, people I've known for most of my life, they live around here, some of them live here in the CCRC, and then I have new friends, people that I've met because of moving here, and that helps me be able to do different kinds of social activities. So my takeaway messages, really, I'm sorry this is taking longer, are have a plan. Don't avoid planning to either move or stay where you are. There's really no right decision or best decision. All of us are different. Our circumstances vary, and what might be right this year could be really wrong, within a month. But think about a plan. Make sure you know what your alternatives nearby or wherever you're thinking you might want to move, what those alternatives might be. And ask questions when you visit or call any of these communities. Because as I said earlier, the vague answers or they seem to be dodging, that tells you something too. So if you get really good answers and keep pushing on them, you may not want to do it in a group, they may not like that, but going in one-on-one asking questions, you learn a lot about the management of these different places. Third thing I want to say is really don't let perfection be the enemy of the good here. Many people that I know, including within my own household, put off thinking about or finding information about options. And their excuse is usually, well, things are changing so rapidly right now. I know that there are more of these age-qualified apartment buildings going up, or there seem to be new versions of CCRCs. I just want to take my time. Well, that's fine, but you should have a plan, and life can really change suddenly. I learned about this a few weeks ago when my sister-in-law got an infection that most of us would have just fought off without any problem at all. But watching my brother dealing with a situation where he didn't have a clue about what they would do was really an eye-opener to me about how fast things change. So as I said earlier, this line from Shakespeare really resonates with me. It's better to be 3 hours early than a minute late. So that's my takeaway message to you all. Okay, so I'm happy to answer questions, and there are more supplemental slides that provide more details about different kinds of contracts that CCRCs have. If you want more information about that, I know that was a question that came up ahead of time.
Great. Thank you so much, Catherine. That's a lot of information, and there are some questions in the chat. So I can just sort of start from the beginning on those and go through those if that would be helpful.
Sure.
The first one that says, what if you were on a wait list for a CCRC and you don't qualify by the time you were off the wait list? How do you plan for such a contingency?
That is a really, really good question. I think you plan for it by deciding that either there are modifications to your current home that you could do to make it safe. And if that's not possible, then you ought to be looking at assisted living communities within where you want to live. And they have shorter wait lists, but not for sort of larger units that may have a sitting room as well as a small kitchenette. But you ought to look at those kinds of communities as well. We have a friend with Parkinson's, for example, who lived with her sister for a while, and in San Francisco, and steep staircase to get up to the apartment because of the way San Francisco homes are made. And it took a while before she got into an assisted living community that has very different levels of assistance, and they've been great, but that was something that they knew about in advance. So I would just recommend that. It is a good question.
Yes. And then the next question from the same folks, what do you think of agencies where you pay them up front and then a monthly fee for their assistance and helping you age in place at your home?
That probably depends a lot on the agency, without knowing details about what's its reputation. Does it abscond with your money? What kinds of aids it can supply? That matters. I know in setting up aids for my father that I was depending on the agency for doing all the background checks, and that mattered a lot to me because he had Parkinson's. And, it really depends on the aides that they can send. And, that is a big problem that if you live in a more rural area or difficult to get to, it doesn't have public transportation nearby, then the set of aides they may be able to send will have to have a car and be willing to drive quite a distance, perhaps, from wherever they live to get to wherever you are. So I would ask questions of the agency of, how reliable that is.
Yeah. The next one it says that during COVID, many more people died in for-profit places than in non-profit CCRCs. There seems to be better help at the nonprofits. Can you comment on this? The rentals are having problems getting and keeping their caregiving people, the carer staff.
Okay, so I think those are two different questions. So the CCRCs, I think it's hard to make a hard and fast point about whether or not for-profits, not-for-profits, CCRCs had more problems with COVID. That seemed to be a larger problem with the assisted living communities. And there, so some of this was just random bad luck. Let me start there. No matter whether you're talking about assisted living communities or the CCRCs, the random bad luck at the beginning was not really being as aware that we had a good test for whether somebody had COVID. And so people would come in and then discover 3 days later they had COVID. But meanwhile, the infection had spread. The virus had spread. So it's a random bad luck. Second thing is, and this affected the assisted living communities the most, but it affects, I think, also, it goes back to the for-profit, not for-profit point. So let me back up a little bit. A lot of these for-profit organizations that own either CCRCs or assisted living communities have multiple layers of who owns what. And if you're looking at a for-profit, it is really important to start saying, well, who's the organization above it? Is this some kind of limited liability corporation? Is there another one above it? Where does that buck stop? And it matters for things like, if it's a CCRC, will I get my entrance fee returned to me easily? Or is one of these upper layers really the one that's got the money? And if it's in financial trouble, does it not keep enough money to pay me when I decide to leave or I've died? And you can go look for whether or not there are any lawsuits against a particular, a CCRC with a particular name. You may find what's going on with that. The point that I want to make here is that the problem for the for-profit assisted living communities, which had high death rates in the initial year, was often that because this organization above it was just skimming off every month they had to be paid, there wasn't enough money being left within the management's control of the assisted living community to get all the safety gowns, masks, have the kinds of cleaning materials that were needed to make sure they didn't have virus around. All that money was just not there. And that's not just a situation for COVID. It is a situation affecting the ability of the assisted living community to deal, or any skilled nursing facility, to deal with infectious disease. And so that's really what you want to know is, are you the management putting aside enough money that you have all the equipment and all the supplies for dealing with infectious disease? That, it seems to me, is a larger problem. The third thing that's somewhat related to this was this enormous shortage all of a sudden of people who are willing to work as aides in either CCRCs or skilled nursing, assisted living communities. And that's where some of this unfortunate random bad luck of somebody coming in who had been exposed to COVID but didn't realize it. After the first year, I think we got a handle on all that. But you're right. I mean, this is an issue, but I would look much more carefully at what's the layer of ownership and management within a assisted living community on CCRC.
So many things to think about, but so helpful to be asking these questions. The next question, it says, we're in the middle of this, and I'm not sure at what point in your discussion that this person is speaking to. So Jean, if you want to expound on your question, you're welcome to. But it says, I recommend people ask for and review the contracts as soon as they decide on a place so they have lots of time to understand and digest the terms.
Absolutely. I think, first of all, you can see the contract in advance. Like when you apply, you will be given, here is the current contract. And you ought to go through that in detail, either consulting a lawyer or your financial management person, advisor if you have one, but go through it. Don't wait until they say, whoa, your name has come up and you've got 2 months to decide if you're going to do this or not. And within that 2 months, you have to pay us the entry fee and get all of your ducks lined up in terms of the financial information we need updated, as well as coming in and doing the physical exam or sending us all access to your medical records, that kind of thing. There's a lot going on in those 2 months. And I have friends who were not prepared for that, and they badly wanted that particular apartment unit. And I am not kidding you that they were so lucky to sell their house the day, the papers passed the morning that they had to then send the money back on to the CCRC. And we were standing there helping them pack up. And the husband starts reading the contract and says, oh, so, this is where using time to your own advantage, whether it's beginning to downsize, as I sort of vaguely said, you might want to move to an age-qualified apartment with the idea that could be an interim move while you're waiting to move into a CCRC. Take advantage of this time, but use it.
The next question is, I understand that 24/7 care in your home can cost about $300,000 per year. Does that jive with what you have seen?
The cost per year depends so much on what the nursing care costs are of the person we're talking about and where they are. When I was doing this, which was 15 years ago, I was paying for my father $16,000 a month, but that was not for a full year. In the end, that was like 6 months. So, I find it hard to believe that you'd really be paying $300,000 for a full year. It must be somebody who needs very intense nursing care. And my father needed to have somebody there 24/7. Don't get me wrong about that, but it seems high to me.
Okay.
I would do it in terms of, think of it as a month and how long you think you're really going to be needing it.
Right.
If you are talking about somebody who needs long-term care, then you really should be thinking about a nursing home, because if it's going to be super expensive, unless you have enough wealth and your own retirement income that you could afford to have somebody in your house. But at that point, you're probably talking somebody who needs like a ventilator and all kinds of other equipment. That gets really expensive fast. And maybe that's where the $300,000 is. But in terms of paying for some level of nurse coming in each week, and then a nurse aide, it seems high to me.
Somebody chimed in that it's over $35 an hour in the triangle now, of which the caregiver gets maybe $20, assuming that's through a an agency.
And that's an important point because I have a friend who needed a fair amount of post-acute care because of an involved surgery, and she hired somebody not through an agency. For a while, she had somebody through an agency, and then she decided she didn't want to deal with that anymore, and she paid somebody privately, and the long-term care insurance would not pay for that. So keep that in mind.
Okay.
Depends on what's in your contract.
All right. Can you discuss the scenario of a very active, sharp-minded single person in their late 80s who wants other active people around? Many of these independent facilities have residents who are not very active. She's on a wait list for a very active CCRC, but it's still 3 years away.
As long as he or she is still very active, stay where they are. Wait for the CCRC to have their name come up would be one option, obviously. That's assuming that when they call, she's ready to go. It is possible in many of these places that suppose that you put your name in that you really want a 2-bedroom apartment, that you just cannot imagine not having a separate bedroom from maybe where you have your office study set up. You want to be able to separate them. But, I could imagine at age 90 or something saying, I really think it's in time for me to move to a CCRC so I continue to meet some people that will know me as I am now, active. And I could call that CCRC and say, do you have any 1-bedrooms available? Because the waiting time is usually much shorter for a 1-bedroom. And then you can come in the 1-bedroom. In some, this varies all over the place. In some CCRCs, the fact that you are a resident, but you still would like to be in a 2-bedroom, gives you a leg up on getting that 2-bedroom apartment. Not every place, but some places. And I would suggest that if you really want to meet some other active people, say in their 80s, and early 90s, you should think hard about, do you really want to stay where you are versus saying, I'll take a smaller apartment and try that. And I can tell you from being on the board of a very active CCRC that I know pretty well 3 women who are sort of mid-80s, late 80s, mid-90s, and others who are, very close to 100, who are very active. And so, assuming that anybody who's past 90 is just not going to be someone you want to talk with at dinner can be a mistake.
Do CCRCs and ALC, assisted living communities, accept a couple where one spouse is healthy and the other spouse needs a higher level of care due to Parkinson's or Alzheimer's?
Yes, I know of situations like that where the couple are admitted, but they're told that the spouse who has the physical or medical problems will have to live either in their assisted living neighborhood or it depends on how they're using their skilled nursing facility if they have one, because many also allow somebody to be essentially a long-term care resident of the assisted living, of the skilled nursing facility.
Okay.
So yes, you can have that, but you probably pay more, but there's a recognition that one of you is pretty healthy, and so you'll be fine.
Okay. And then there's a word of warning, which I don't know if you've encountered this as well. Maybe you can speak to it, but I want to warn everyone to know how terms of return of buy-in fee can be changed. After my father passed away, his wife changed the agreement with the community in Silver Springs, Maryland, from distributing half the amount to our family / half to hers to all to hers. We could not do anything to counter this betrayal of her father. So it essentially changed how the money was returned.
I don't know about that. My guess is that somehow this person has gotten a lawyer involved with the will, and maybe, but I don't know. That may also be state regulations on whether or not you can change things like that.
The point is, it was not part of the will. It was just the agreement, the contract
Right.
with the community. And
Right,
that's
I
why
understand.
we
I
couldn't
do
do anything
understand that,
about
but
it.
I don't know.
Hmm.
So
Yeah, no, but that's good to think about, Gwen.
just, I don't want that to happen to anybody else. So know how those terms can be changed, and maybe somehow get it in a legal document, because since we didn't have that, there wasn't anything we could do.
So sorry. That's
Yeah.
terrible. Um, okay. On a more positive note, someone said, "Thank you for the most in-depth talk I have ever been part of, especially the financial health questions to a facility. Much appreciated." And very helpful overview. Thank you. Someone shared a resource. It looks like it's a CCRC resource. I don't know, Lee, if you want to share a little bit more about what you've put in the chat.
Yes, it's just the resource from the Department of Insurance in our state, since they heavily regulate, but they also provide a listing of all the CCRCs, so you don't have to start from scratch and look in the phone book. And it's a good summary of all the CCRCs in North Carolina and the different models, plans, etc.
Yeah, thank you. I think I had also provided a couple of resources ahead of time that were part of the invitation or information about this whole series.
Yes, and that the resources, Catherine, that you shared will be or on the website and will be there on the with the video of today's program as well.
And actually, let me just add, if you're interested in moving to another state, you can find in many other states also provide something similar. They're not always as good. Massachusetts is very detailed, but you can get information from other states too.
Okay, the next is a comment that people investigating CCRCs also need to understand whether the community's financial model is type A, comprehensive or inclusive, type B, modified, or type C, market rate daily fee, fee for service rates if the resident needs accelerated care.
Yeah, that's why I provided those as supplementary slides.
Yes.
I didn't think that was, if I'm only supposed to speak for 45 minutes and I spoke more than that. But
yes.
But yes, and it is really, but that's one set of things to know about. But then really trying to get more information about how well are they managing the finances of the community is important.
The next question, and you may have touched on this briefly, but what happens to people who have no assets and need memory care or skilled nursing?
So this is a big public policy problem. I think that's why I said at the beginning, it's not part of this discussion. So if somebody has no assets and very low annual income, say that they depend on their Social Security check, they are really dependent on Medicaid to cover their costs of going into an assisted living community that has a memory care unit or a nursing home. And this is a public policy problem right now. And if the Congress does cut back on Medicaid, I think there should be a lot of people with senior relatives who should be protesting that. If you're talking about moving to a CCRC, you are not in that category. You have sufficient income that you can pay that entrance fee, either by selling your current house, but also that you have enough retirement income sources to pay the monthly fees. So, the monthly fees can be anywhere between $12,000 a month. I mean, it really depends on where you're talking about and how large the apartment is, et cetera. So I think this public policy problem is a big one. We don't have sufficient good housing and ways of caring for the health care and assistance needs of a lot of elderly people with low retirement incomes.
Okay, I know we have just a few minutes left and we have several more questions in the chat. Just somebody sort of highlighting that they're in the middle of deciding on CCRC occupancy. The scenario is exactly as you said. You had to ask for the contracts a few days before signing, and the terms freaked the couple out. We needed time to understand them. I asked a question early on about private equity takeovers of CCRCs. What kinds of facilities are at risk of this?
That's a very good question. For sure, the for-profits are. But in addition, any CCRC or any, I mean, if you're talking about assisted living communities, since most of them are for-profit, they fall in the same category. But any one of these, if their financial health does not look strong to you, and they are not, so they've got a low rating for their credit, and they seem to be just covering their operating expenses with revenues coming in, and you don't, and they may be borrowing or taking money out of any endowment that they have or set aside reserves, then you will really have to wonder, is this a place, I mean, this is where the risk gets high. Is this a place that could be a takeover target or an acquired organization? And, you know, it's not like it has to declare bankruptcy to be acquired. I mean, this can just happen. It could be a merger. And then the worry is, you know, what is this private equity firm doing? Usually what they're doing is putting money in, and if they're really want to take their hands off, that they believe in having more retirement communities, but they think that they could put in better managers to turn the whole operating expenditure revenue source around, that would be great. But if they put in a different management firm, which says, well, the way to deal with this is to cut back on costs or to really raise the monthly fees, then you could have residents who are saying, I cannot pay those monthly fees. And that is a real problem. I mean, to me, that's a catastrophe for people who, you know, maybe in their 90s by this time and have lived in the CCRC for quite a long time. So you want to make sure that you're trying to get a good sense of how well managed is this organization, because if it's a target, you know, you don't know.
Well, I see that we have basically run out of time here, and I want to be respectful of our presenters' time and of everybody's time. So are you okay, Katherine, if people have specific questions that they could email you, or they could email us and we could ask you some additional questions? I know that there's some in the chat that haven't.
Yeah, that would be fine. I'm still dealing with stuff related to my sister-in-law. So yeah.
Okay. Well, we won't bombard you with questions, but if there is a particular question from today's talk, both the video will be available. There's a list of a number of resources. I'm putting this link in the chat now. So you can certainly find out more information then. And you can also contact any one of us social workers here at Jewish for Good in the helping department if you have additional questions, or would like more information about resources in our area related to today's topic. So I want to thank you so much, Katherine, for all your information and your help and answers to many of these big questions today. I can see reflected in the chat that people feel that way as well. And want to just let folks know that at the end of the week, we will be sending out an evaluation form. And tomorrow's talk is all about grief. It's why doesn't anyone understand unlearning what we thought we knew about grief with E. Billou. So we are excited for tomorrow's talk as well, and looking forward to seeing you then. We'll send the link out around 9:30 tomorrow, right before the talk, so it's fresh in your email.
Well, thank you.
Thanks, Catherine. And thanks all for participating today.
Thank you.
I don't get know what I found that interesting.
So Shoshana, did you want me to stay on, or what's the,
Um,
there was some discussion about that earlier, but I don't remember.
yeah, let's stay on for 1 minute, and then as folks kind of sign off, just I have to remove people without reporting them to Zoom. I don't know why it's automatically checked, but
Either.
sometimes folks need.
Shoshana, we can stop the recording as well. I don't know if I have access to that.